Chairman, appreciate it, and I appreciate the testimony and the fact that you all are in the trenches every day doing great work with our young people. Dr. Hoover, you talked about telehealth, and I just want to be sure that we're also focused on the broader behavioral health and specifically substance abuse. It seems to me that telehealth is one of the few silver linings in an otherwise dark cloud of COVID with regard to substance abuse treatment, that there has been some real improvements. Would you agree with that?
I would agree with that. I mean, certainly the opioid crisis has brought attention, and that has been exacerbated during COVID. So the funding provided by the federal government to states and communities to support the opioid crisis has been tremendous. And certainly there's been an improvement in care. Telemental health has improved that as well.
This is why we've got to continue the reimbursement under Medicare, Medicaid particularly for substance abuse at a time when we had 100,000 drug overdose deaths in the period from April this year to April last year. So during 1 year, a record level. That was a 28.5% increase in overdose deaths. Really heartbreaking because we had made great progress in 2018, 2019. Now we're unfortunately seeing more and more people dying of overdose deaths. The reporting we have about young people, because that's the topic today, shows that we have seen anywhere from an increase of 3 times higher number of overdose deaths to 13 times higher in 2021 compared to the numbers we had from 2019. And by the way, dramatic increases among Black youth in terms of overdoses. It's particularly concerning. Ohio State has done a report recently, looked at it from a different perspective. They said how many years have been lost. And so their analysis is that beyond the numbers we already know, the loss of years lived for more than 21,000 young people who they tested from overdoses show that adolescents and teenagers 10 to 19 lost cumulatively 200,000 years of life. And when they expand the study to include 10 to 24-year-olds, it grew to more than 1 million years lost. So it's a shocking way to look at it, but think of all that lost potential and all that God-given potential being ruined. So this is a huge reason that we need to figure out as a Congress how to get back on this issue. And deadly fentanyl is killing, we think, about 2/3 of these kids. So this is synthetic opioids streaming across the border. We've done a lot more in terms of the prevention side and the treatment and recovery side, but obviously not enough. And what we see in Ohio is that this deadly fentanyl is often masked as other substances. So it looks like a pain medication or an anxiety medication or ADHD medication. And we've had parents approach me in Ohio to talk to me, about this issue because they believe that their son or daughter died of an unintentional overdose by being deceived about what was in a pill. So Dr. Hoover, talk to us a little about that. Anybody else jump in. What do you think the reasons are for this big jump in overdose deaths, and how much of it do you think is attributable to these cartels putting fentanyl into other medications?
So I'll jump in quickly and defer to Dr. Benton on the kind of impact of drugs and the medical side of this. But certainly in terms of the comorbid mental health issues, we know that the substance use issues we're seeing increase in young people are likely very related to their increase in depression, anxiety, and post-traumatic stress. Not only are we seeing increases in that pre-pandemic, but we're seeing real exponential growth in that in the context of COVID. So we know when that happens, we see increases in substance use. And so it's not surprising when you give those really tragic numbers. I'll defer my time over to Dr. Benton with respect to
You're talking about self-medication because of other behavioral health or mental health challenges.
That's a piece of it, absolutely, that self-medication to address anxiety, depression, trauma, and just to really cope with some of the isolation and loneliness that our children have experienced over the last couple of years.
Dr. Benton, can you talk a little about the synthetic opioid issue, the fentanyl getting into other medications?
Yeah, so what I can say is that we are seeing increases in utilization across the country. And unfortunately, I have to say that in many mental health programs, there's not the robust substance use and addiction treatments that we'd like to see, and a major focus of expansion of resources and treatment for young people needs to focus on increasing the integration of substance use and mental health treatment services. We know that for young people with any mental health condition, the comorbid use of substances only makes the outcomes worse. And the substance use is associated with worse outcomes, including suicide and other impulsive behaviors that land young people in bad situations. And so that has to be a focus. Right now, they run almost as two separate systems in some ways. And that really needs to be a focus of our efforts going forward if we're going to address the substance-related morbidities that we're seeing right now.
Okay, I think my time has expired, but Trace, I'd love to hear from you on this. If you have a minute, Mr. Chairman, if Trace has any thoughts.
Yeah, I would love to. Thank you, Senator. I think, right, when we talk about all these statistics, it's really alarming, but I also think that there is a beacon of hope. Since Youthline's inception, we've experienced an annual increase in contact volume of about 15% annually, with an additional increase of 3 to 5% since the COVID-19 pandemic. And obviously, while that proves that there is a need for mental health care, there's also so many teens reaching out for help. And I think that that is really inspiring. And I think it shows the resilience of teens in regard to mental health challenges and substance use challenges. And so I think if we can really ensure that the people reaching out for help are able to receive help, we will get really far on this issue.
Thank you. Thank you, Chairman.
Thank you.